Hi, so if you came across this video, it's probably because you googled or YouTubed something like depression treatment, and most likely it's not because you were having the best day. So, probably it's because you're feeling depressed or not yourself or like something's wrong. Um, and here I'm just gonna tell you one of the ideas of what could be wrong with you. It doesn't mean that's what it is, but it's just something to consider, and consider the tests that I'm going to say would be useful to do if you're feeling depressed and you have the other symptoms that I talk about. So about 30% of people who go to a psychiatrist and are depressed and get like antidepressant medication, about 30% of them respond well to that medication and they improve. Another 30% responds to the medication for a time, but they relapse back into depression, into similar state they were in, and the other 30% doesn't respond at all. So we actually only have about 1/3 of people who get better and stay better with the current antidepressant medication. And I'm gonna talk a little bit about why I think this is, and what's another problem that's been overlooked a lot by doctors. And I didn't just make it up. There is research on this. I'm gonna tell you some sources. It's newer research, but it has been helping some people. It helped me and helped some of my friends that I know, so hopefully it can help some of you as well. And what I'm gonna talk here is autoimmune disease. I wrote here Hashimoto's, that's a thyroid disease, but I don't think it necessarily has to be a thyroid disease. It could be any autoimmune disease. I even recently read that there's research that arthritis, which is also a type of autoimmune disease, can cause similar depression, just same as Hashimoto's thyroiditis. So I'm just going to talk a bit about treatment that I found for autoimmune disease. So autoimmune disease is basically really horrible because it means your immune system is doing completely the opposite of what it should be doing. It's releasing antibodies and attacking your tissues and proteins in your body instead of attacking bacteria and viruses, which is what it should be doing, and that can lead to all kinds of inflammation. It could be in your stomach, or it could be attacking, destroying your thyroid, and also recent research shows that it can lead to inflammation of the brain, which is a very serious issue, and that can lead to anything really, because it's in the brain. It can lead to depression and psychosis, and you won't even know what hit you unless you understand that you have autoimmune disease. So you see some things listed here. So basically, this is the treatment so far that I found. For me, it's not random, I didn't make it up. It's based on some sources. It's not like hard science, it's still being researched, but it's better than the alternative. The alternative being antidepressants and antipsychotics, because they don't seem to work at all for these mental issues related to autoimmune disease. They might work for people who have some kind of chemical imbalance in the brain, so maybe that's those 30% of people who respond. But could be that a lot of people in the category who didn't respond at all to this antidepressant medication is because the issue is the autoimmune disease, which is very different. And unless you treat and reduce this inflammation in the brain and the rest of the body, these SSRIs are not going to help you, because if you keep having inflammation in the brain, it will just keep affecting it and damaging your brain. Okay, so what are the symptoms that I had, and why am I doing this video, and how did I come to this conclusion of this treatment in autoimmune disease? Well, I had a lot of symptoms. It's not just like depression started, I felt sad. That's not really what I felt. Depression is kind of general word. It doesn't really describe well what exactly is you feel. Well, anyways, I had a lot of symptoms. Like in 2012, I was in grad school, and I started to notice, like in a mirror, swelling below left eye. Like I could see it was kind of like an eye bag, and it was getting like reddish purple color, but it was specifically only under the left eye. So I didn't like how it looks. First of all, it started to bother me. And also, I just thought it's strange, Yes, it's grad school, it's stressful, and you do an assignment until 2 a.m. and you don't sleep. Okay, you can get bags under your eyes, but this is under one eye, and it was looking like there's liquid in there, as if you filled it up with something and it's kind of hanging. So I went to the doctor on campus, and she really dismissed me. She said, "No, you look fine." Well, that wasn't very useful. I mean, I didn't ask her if I looked pretty. I was asking her something's wrong, and she didn't bother to investigate it further. She just said, she didn't give me any advice. She just said, "No, it's fine. I don't see anything there." Well, she actually turned out to be very wrong, which was after confirmed by an ophthalmologist. There was something wrong with my eyelids because of inflammation, but I found out it took me 4 years, or yeah, about 4 years to find out at least that something was wrong and I wasn't just imagining it. Hopefully, for you, that could happen earlier. Another symptom was a burning sensation in both eyes during the day. Like they were very kind of itchy and just as if there was something stuck, as if an eyelash or a dust particle. And I would keep washing them, and I don't even wear makeup. I do wash my face, but still, it kept feeling like there's an eyelash, and I kept washing it, and nothing was coming out. So that was really bothering me. Then another worse thing started to happen is that after eating, in about 15 minutes, I would start to feel like really dizzy. Sometimes I didn't eat much for breakfast, and I would go to my class, or maybe I was doing an assignment, and then at lunch I would eat, I would go back to my laptop, and just suddenly feel so dizzy, like I can't really understand what's written, I can't focus on the question, I just want to lie down, it feels hard to sit up. Yeah, that was really a bad feeling, and it just kept happening every day after lunch or after dinner. Also, I started to gain weight, which never happened to me before. In high school, I looked more like anorexic, so I was always quite thin, but then rapidly I started to gain a lot of weight. I gained about 15 kilograms pretty quickly in less than a year. I increased like 2 sizes in terms of pants, so from 5 to 9, and it all happened very rapidly. I was 3 for a long time, and then 5 for many years, and suddenly I went to 9. Also, I started to feel really cold inside. Like, I would be in a house where the thermostat is set at 23 Celsius, and I would feel freezing. My hands would be really cold. I would want to wear a scarf. I wouldn't want to take off my scarf because right away my neck would freeze. So these were all of the physical symptoms. So in 2013, symptoms continue. I continue to gain weight. I have to buy new pants. And also, I'm starting to have more and more problems with food. Like after any meal, I start to feel really full. I feel very bloated, like as if I just went to an all-you-can-eat buffet, even though I don't do that, and I didn't even eat junk food. I didn't really eat pizza or hamburgers. I ate like normal food. Well, I considered it normal. But yeah, I was clearly noticing an issue with the time after I eat, and I started to notice shortness of breath, like even just taking the subway and going up the stairs became difficult, which never happened before. I mean, I used to go hiking in Alberta and mountains, carrying like a heavy backpack for 10 days, climbing a mountain with a backpack. I've done all that recently, like in 2011. But 2 years passed, and I'm not 80 years old, I'm under 30, and I get this just shortness of breath, just walking up just the stairs to get outside from the subway. And then the very bad, like, mental stuff started to happen, like intense anxiety, just waking up, feeling anxious, like something's bad about to happen, or as if something very bad already happened, I just don't remember what it is, and suddenly I wail and realize how bad it is, and this started to occur every day. So in 2014, it all still continues, and I just feel really tired every morning, like I can't force myself to wake up. I feel really sleepy the whole day. My eyelids feel really heavy, while the whole eye thing continues, the burning sensation, and the eye bag under the left eye for some reason, and the eyelids feel heavy. It's difficult to keep them open. As I said, anxiety from early morning, this feeling as if something's happening, something is about to happen, just this constant feeling of agitation. Yeah, feeling dizzy, not able to concentrate on what I'm reading or doing an assignment, just always wanting to lie down. Yeah, not able to hike uphill. Like, I went on a trip again to Alberta, and it wasn't even half as intense as when I went in 2011. I went, like, on a simple trail without a backpack, and I could barely, I don't think I even made it to the top. Like, I couldn't breathe. I felt like 500 pounds because I was just out of breath with every step. And also, I was feeling very depressed. Again, depressed, like, it's kind of general. Like, some people say they describe it, it's when you don't want to do stuff, your whole day, you don't have motivation, lack of energy. Well, that's not what I felt, so I don't know if it's even the right word. It's more like a constant feeling of that something's terrible going to happen. Everything's out of control, and like your whole life is just going downhill from today. So it's kind of feeling of terror and panic. Again, like, doctors describe it as depressed, but I guess it's depression and anxiety. Yeah, that's a very general term. It's like it's just terrifying, like feeling of terror. I don't know, like if you're going on an airplane and it starts to like really shake and there's noise, like you get this feeling going through your stomach, like because you think it's gonna fall, and you're concerned about that moment that it's gonna be falling, and you're gonna be conscious while in it. It's kind of like that. Well, could be different for everyone. In any case, clearly, like, it's some kind of really bad mental state that I started to have, like, every day. So what did I do? Well, I went to a doctor. I mean, that's what people do. I had blood tests done. Because I described all the symptoms together. Again, there just were so many symptoms. Maybe, again, it was confusing for me how best to describe it, and confusing for doctors. What is my main concern? Because I guess I was just saying everything's bad. Like, I feel this anxiety, I feel depressed, I feel dizzy, I feel tired, I feel sleepy. I can't breathe, I'm gaining weight, my eyes hurt. So basically I was sent for all these tests. Also, I had like really severe abdominal pain in the lower abdomen after eating. It was really bad, but especially towards the evening. Like, I couldn't even be sitting because it was so painful, like as if you're going to explode. I don't know, maybe like if you have appendicitis, you get this kind of extreme pain. So I would just get that in the evening after food. And then it would be really difficult to be out somewhere because you can't lie down, and I just found it so painful to sit. Well, and then, you don't enjoy whatever you're doing. You're just thinking about the pain and how you want to go home and lie down. So I had ultrasound done and gastroscopy. And I started seeing a psychiatrist. So, okay, I started seeing all these doctors. What did they do and what was the diagnosis? Well, the family doctor I was seeing then didn't say anything useful, except that I might have IBS, irritable bowel syndrome, that was related to my lower abdomen pain, and GERD, gastroesophageal, long word, reflux disease. That's because I kept having like heartburn and indigestion. So yeah, I mean, I agree. I guess I have both of that. But they didn't say what I can do about it and what could be the cause. And so what's next? They just said, oh yeah, well, lower abdomen pain and this acid reflux and burning sensation. Well, it's often that women have IBS. Very common. Well, yeah, okay, but so what? They didn't say what you should do about it. So a psychiatrist said, yeah, you have severe depression, psychosis, and anxiety. Psychosis. Because I have like very persistent thoughts, ideas, not being able to control my thoughts, like being obsessed about some specific idea. So it wasn't exactly depression. Again, as I already described it, it's more like feeling of terror and panic and being obsessed of an idea that something's going to happen that's out of your control. So this was in 2015, and the psychiatrist just said that, well, these feelings happen to people because of stress from grad school, And they're probably temporary, so we'll just put you on some medication. Um, okay, I mean, it's I see it's not a bad start, because I guess there are cases where it's just temporary, so just from her experience and statistics, she could be right for some people, but I don't think it was correct that she kind of dismissed whatever I described to her about my other symptoms, such as feeling dizzy after food, um, being sleepy, tired, having my eyes burning and swelling under the left eye. She kind of just said, yeah, well, the family doctor takes care of that. It's not related to, mental issues. And I think that's where it's really wrong, because your head and your brain, they're not separate from your body. And again, that's what the recent research showing, that a lot of people, well, in their sample, who have psychosis and depression, the actual cause of that seems to be inflammation, which is caused by an autoimmune disease. So the inflammation is the direct cause, because there's also inflammation of the brain. And my psychiatrist just completely dismissed the idea that those physical symptoms could be in any way related to mental issues. Like, she just kept referring to stress due to grad school. Yeah, it's stressful, but many people go to grad school and many people finish it and they're not psychotic. So I don't know why she didn't even consider the idea that it could be a specific condition that's causing all this. So what is the treatment that they prescribed? Well, the family doctor prescribed antacids to deal with GERD. Psychiatrist started with mirtazapine, which is an antidepressant. That didn't really help. And again, I did not have just depression, which is, I guess, the mean is when you lack motivation, energy, you're pessimistic about everything. No, it's more like psychosis. And it wasn't the same feeling throughout the day, which I think they also should have paid more attention to. Because I think when you have a chemical imbalance in the brain type of depression, then it's more throughout the whole day. But my case was that I could feel okay in the morning, but towards 5 p.m. I would start to feel really terrible and have a panic attack. And then by 8 or 9 p.m. I would feel better. So I described that to her, that it's a specific time that I get very obsessive thoughts, I can't control my thoughts. They're very negative, and I feel very anxious. So she said, okay, well, it's some kind of psychosis, so you need antipsychotics, and she prescribed risperidone. It didn't work for me. Again, I kept feeling the same thing towards 5 p.m. I would just freak out. I would have to call everyone to check if they still exist. Yes, I wasn't sure, I could be sure in the morning that people exist, but by 5 p.m. I was not sure. Yes, it might not make sense to some people who never had psychosis, but it's pretty random, but to the person, it's completely true. So by 5 p.m. I would freak out because I wasn't sure if people that I know exist. Yes, it's strange, and the psychiatrist just said, well, we started at a very low dose, so I think we need to increase it. So she increased the dose of risperidone and mirtazapine. I don't remember what I took, 75 milligrams of mirtazapine and 2 milligrams of risperidone per day. They make you really sleepy, so they don't help with the energy issue, and for me they didn't help me at all. Again, I'm that person who is in the 30% of people who completely don't respond to antidepressant and antipsychotic medication. So I continue to experience all the symptoms, very anxious, psychotic, dizzy, depressed. But again, probably depressed because of the thoughts and stuff I experienced. I don't think I exactly had depression. It's just the whole experience, it just makes you very depressed and question whether you want to live like that for much longer. So because I had such panic attacks towards 5 p.m., psychiatrist decided to try benzos, so she added lorazepam. That's a benzodiazepine medication. It's used for anxiety, but you can read more about them. There are many issues with benzos, such as they're quite addictive. You can't use them for long because you develop tolerance, and then you experience well, you can experience very bad withdrawal symptoms. So they're pretty serious drug. So mirtazapine was switched to Cymbalta because the psychiatrist's strategy was to just keep trying different antidepressant and antipsychotic medication. And I did keep telling her about my feelings of being so dizzy and after food and not being able to concentrate. And she kind of said, just, well, yeah, you have some separate problem related to like stomach issues, and depression causes like lack of energy and sleepiness. But I think she was wrong again, because she kept using the word depression, and again I keep saying it's not exactly what I have, because I had a specific experience from about 4 to 8 p.m. which was very horrible, but it wasn't lack of motivation. It was an experience such as you would have if you have a really bad trip, like on acid, or you get really high and you become very paranoid and you start having the psychotic thoughts. You could have this with THC, because THC could actually lead to a psychotic experience in a healthy person, like depending on the person or how much you consume. But I'm just saying, if you ever try something like acid or weed, well, even with ecstasy, you could have a very bad trip or withdrawal. And it's not like a depressed experience, it's more like a very terrifying experience where you might not be sure that your friends are really your friends, or that people exist, or whether you exist, or who you are. It's just like kind of breakdown of your personality and way of thinking that you're used to, and it's completely out of control. So of course it's just terrifying, and you start to panic, and in case when it's a bad trip, it goes away the next day and you just say something like, I'll never smoke it again. Well, yeah, you don't end up doing that, but it's just something you say. But in this case, I wasn't high, I was just experiencing this every day from like 4 to 8 p.m. And the psychiatrist kept saying, you have depression. But again, that seems to me she wasn't really listening, because I never told her I have no motivation or I don't want to do stuff. I was telling her that it's so terrifying, and even if I'm kind of okay in the morning, I know that the experience is gonna start again at 4 and it's out of my control. There's nothing I can do about it. Also, then it ruins the rest of the hours that I have, which were supposed to be okay. But if you know something's so bad's going to happen, you're not gonna enjoy the time before it. So she gave me some Balta, and that just worsened things because it gave me horrible insomnia. I couldn't sleep. Like, I would fall asleep and wake up at 4 a.m. and couldn't fall asleep until 7, which was of course horrible because I have to wake up from work at 8, so I couldn't function. So she added trazodone, which is a sleeping aid. So I was on 4 medications in total. I took some Balta in the morning, hoping that by night it would kind of wean off, and then I was taking lorazepam in the evening and risperidone towards going to sleep, and trazodone for sleeping. But again, it really wasn't working. Like, I only experienced the side effects, such as feeling more mentally slow from risperidone, because that's what antipsychotics do. Like, they do slow down your cognitive function. I still wasn't sleeping well from Cymbalta. I was gaining weight because mirtazapine and risperidone, that's one of like major side effects, and why many people stop taking them. It's because they make you gain so much weight that it's just not worth it. I think the only thing kind of helps is lorazepam, but again, benzos are very strong. They're not meant to be like an everyday medication. So it does help, well, because it really like slows you down. You become really sleepy, and just your thoughts kind of slow down. I mean, it slows down your cognition. It's meant to be taken as an emergency, Even like the doctors, they tell you, well, you can use it for 2 weeks. You shouldn't be using it longer than that. So that's not a solution. yeah, if you read about benzos, I mean, they have so many side effects, and main thing is that they slow you down mentally. So how can you work and do stuff you want to do if you're feeling so slow and you can't take in information? And they actually also take away the motivation to do stuff. So in spring of 2016, I was on Cymbalta, trazodone, risperidone, and lorazepam, and I've been on drugs since October 2015. Again, I said what I tried before, like mirtazapine and risperidone, then stuff was switched and added. This combination didn't help, so psychiatrists decided to go with another antipsychotic, and she switched risperidone to olanzapine, which is an older and stronger antipsychotic. Everything only got worse. I was completely not sleeping, and I associated this with Cymbalta because that's when it all started. So I just stopped taking it and stopped taking trazodone because I think Cymbalta was only causing me to be insomniac and wasn't helping at all. So I continued with olanzapine and sometimes took lorazepam. But again, lorazepam, like, it's not a solution, and I was scared to take it too frequently because from the reviews I read, you can have like really horrible withdrawal symptoms, which will make everything worse than it was before. Well, on olanzapine, I couldn't completely function. I mean, I couldn't function completely. I think it's a feeling of kind of like having Alzheimer's. Yes, I didn't have it, but just from reading and comparing my experience, I think that's what it would feel like at some kind of early stages of Alzheimer's, because it completely started like taking apart my thoughts and personality. I couldn't learn new things, like when I would open something, try to read. First of all, I wasn't sure whether this should be interesting or not. I just kind of had a memory that, oh, I remember I like to read on Wikipedia about the economies of different countries. I think that's what I like to do. But then I would open it and just see kind of words and read a paragraph and forget what it's about, or like I would have no interest in it and not be able to put like the point or the meaning of the whole page together. So I would just forget what I've read. Then I kind of just have memories that what I like to do after work. But so I was just kind of trying to do that. I didn't want to, like, I had no really desire to do anything. It was just like based on habit and memories. Like, I remember, I think I go play ping pong. Okay, I'll try that, but I'm not sure if I like ping pong. I'm not sure what I like at all. Like, and I wasn't even comprehending any new information. And actually, I started reading about olanzapine. Well, first, if you read reviews, a lot of them confirmed the same thing. People said, like, I think this drug can cause brain damage, and I agree, because that's what it felt like. Again, it's might help some people, like, especially if you have schizophrenia, I don't know, but again, clearly, well, because I found out later, my issue was autoimmune disease. I don't have schizophrenia, even though the psychiatrist suggested that I do. It does not help people who don't have the schizophrenia and this type of psychosis. It's just the opposite. It starts to completely slow down your cognitive function and dampens your motivation, willpower, kind of your interests. You know, that feeling that something's interesting, it dampens it, and you don't understand anymore why you used to do stuff or like stuff or what you want to do or what you should do after work, because just nothing is interesting. Well, what did the psychiatrist do? Well, she still kept going with the idea that I just need a different antipsychotic, and she switched olanzapine to Latuda, which is a newer antipsychotic. Well, it's a bit better. I mean, nothing I tried was as bad as olanzapine, but it has similar effects. So again, this was spring of 2016, and already 4 years passed since I've been experiencing the symptoms and going to different doctors, getting ultrasound tests, gastroscopy. Almost a year since I've been trying antidepressants and antipsychotics. You know, and nothing was helping. Latuda didn't help. It wasn't as bad as olanzapine, but not as bad doesn't mean it's okay. It was not okay. I noticed, like, I wasn't able to speak on it, and from reading reviews, some other people wrote about the same issue. Like when I would try to hang out with my friends, like if they would say something, I would think, oh, I want to respond, and then I kind of had a picture in my mind of what I want to say, but I couldn't put it in words, or I wasn't able to make jokes. And I mean, all that in itself is just completely depressing. So that takes away the whole point of taking it if you find yourself like losing your personality and ability to function socially. Like for me, that's just terrible. So it's just not worth it. I mean, I don't think it was having really any positive effects anyway. So with some ideas from my mom, anyway, in June 2016, I was skeptical, but my mom wanted me to do it. Like, she wasn't happy that I was taking antipsychotics. I mean, because me and her both agree it like influences your cognitive function in a negative way, and they weren't helping me anyway. So she said, you should redo your blood test because like just something's wrong physically. Like you have all the symptoms, you gain so much weight. I mean, in less than a year, I gained 15 kilograms, right, and went up to pant sizes, and all this like feeling dizzy, the eye swelling. My mom actually agreed that I have swelling under the left eye, not like an eye back when you get tired, but just under one eye, like this kind of big swelling under the eyelid. And actually, when I went to an ophthalmologist, she did find quite bad inflammation, like of the skin inside the eyelids. So I wasn't making it up, I wasn't just having eye bags. So I went to my family doctor and insisted on redoing blood tests to check my thyroid again, because I did it before. And the doctor said it was fine, like when I did it several years ago. But this time I insisted that the test include not only free T3 and free T4 levels, but also anti-TPO and anti-TG. So these are the levels of antibodies in your blood. And my previous test, which is what they usually do when you ask, about thyroid issues, is they check free T3 and free T4. And because those levels were fine, the other time my doctor said, well, everything's fine, your thyroid's fine. Okay, so this is the result that I got. So again, the new things that were added were the anti-TPO and anti-TG. And the first three values, the TSH, free T4, and free T3, are in the normal range. What as the doctor saw before, that's why, before that they said your thyroid's okay. But if you look on the right at the anti-TPO and anti-TG levels, they're red. And they're red because a negative test result is a normal result. In this case, that means having 0 levels of these antibodies is a normal test result. So any level above 0 is not normal, because it means your body, your immune system is releasing these antibodies, and these ones are usually, when you have them, it means they're attacking your thyroid. That's why they check them. I don't know why they didn't check them on my previous test. But yeah, that's what I want to mention to you, that if you go, please ask for these counts to be included. Don't just check the T4 and T3 levels. Because this is where the endocrinologist finally said, yes, so something is wrong. Your immune system is attacking probably your thyroid. Like something's going on. It's attacking your own body when it shouldn't be. So finally, I had some kind of answer that what's what my mom's been telling me, and I was skeptical, is that I have autoimmune disease. So everything I was doing before was just completely wrong. And I said to the psychiatrist, and she was kind of like startled. She didn't know what to say. She said, well, your family doctor should have checked it and told me. Well, the family doctor told me the psychiatrist should check my blood test. So anyways, they were blaming each other. But yes, when you have like an underlying disease that's causing like psychosis that can't be treated with antidepressants and antipsychotics, because you're not getting rid of the cause. Like in this case, you're not getting rid of the inflammation, and you're not getting rid of the antibodies which are attacking your thyroid. And there could be other antibodies. I didn't check the levels yet. They could be there as well, and there could be brain inflammation. So clearly you have to deal with this issue, and SSRIs don't help here. So I stopped taking Latuda. Yeah, when the endocrinologist saw the new thyroid test results, he concluded that I have Hashimoto's thyroiditis, and he prescribed Cytomel T3, 12.5 mcg daily. So again, my free T3 level were in a normal range. He didn't prescribe it because I had a low level, but he prescribed it because Cytomel actually helps with inflammation and fighting the antibodies that I have, which shouldn't be there, and that way it can help with like psychosis and depression. Um, yeah, so basically I stopped taking all the antidepressants and antipsychotics because in this case, clearly, they're not useful at all. They're just causing all the side effects but no improvement because you have to treat the disease. If you have autoimmune disease, you have to treat it. Otherwise, it's just gonna get worse. If you have Hashimoto's thyroiditis and you keep having antibodies that attack your thyroid, well, it might just completely destroy your thyroid, which is an important organ for producing, important gland for producing different hormones, and they affect many things in your body and mood as well. And autoimmune disease is not only a thyroid disease. In general, it's a disease that causes release of antibodies and inflammation. Like, there are types of arthritis, which are an autoimmune disease. There's a type of diabetes, which is also an autoimmune disease. These antibodies can lead to inflammation in the brain. There's research on that now, and that can change your neural circuit. That's what I read, and of course, that can lead to anything like obsessive thoughts, hallucinations, psychosis. I mean, anything is hard to say, right? Okay, so I started only being on Cytomel, just taking it every morning, 12.5 mcg in June, and pretty quickly, at least my thinking returned. Like, I was able to take a computer science intensive summer course in June and July, and before that, I wasn't functioning at all. Like, the worst thing that happened was olanzapine, which completely was destroying my cognitive ability, and my work involved statistical programming, and I couldn't do it. I had to quit my job. So before June, I left work because I couldn't sleep, I couldn't function at work, I couldn't program, I couldn't understand things that were written on Stack Exchange when I was trying to figure something out. I couldn't learn new things, and just the whole time I was having horrible anxiety that I couldn't concentrate on the work task. So it really felt something similar to dementia from what I read, because I'm forgetting things. I couldn't write emails properly. I had people be confused about what I said. I was trying to say in my email, and I did feel like I'm having difficulty in putting a thought together. So it was just all really horrible with these antipsychotics. So stopping them and starting Cytomel really quickly, at least gave me back my thinking, and then my normal sleeping returned. I was able now to go to sleep from 1 to 9, 2 to 10. I started losing weight in several months. I went back to my almost previous weight level. I lost 13 kilograms, and these anxiety and depression, psychosis, they definitely decreased. It was much worse before that. Energy increased. Yeah, I was able to actually do this course and do the assignments and just read all the material and go through the programming exercises. Because before that, as I said, I wasn't functioning. I had no energy after work. I couldn't even function at work, and after work, I couldn't do anything. I mean, I tried to play ping pong or go out with people, but I couldn't read stuff. When I tried listening to a podcast, I wasn't understanding the point of it. I didn't have the energy to read something. Yeah, so Cytomel definitely made a big difference, and from what I read, is that it helps to reduce inflammation, and the levels of antibodies that are attacking your thyroid, which is really important. This is what has to be addressed when you have autoimmune disease. So I started reading more on Hashimoto's, and I added selenium, omega-3 oil, and probiotics, and this all is taken to help reduce inflammation, because that is the main issue with this disease. You have antibodies attacking regular proteins in your body, which are supposed to be there, instead of the antibodies attacking viruses or bacteria that would cause disease. So, like, your immune system is doing something very wrong, and it can lead to damage of organs such as a thyroid. You can have like inflammation around joints. That's when you get arthritis. You can have damage there. You can get inflammation of the brain. That can lead to brain damage. So you really have to focus on fighting this inflammation and fighting the release of these antibodies. So again, these are some things I started to take, which are supposed to be anti-inflammatory: selenium, omega-3 oil, and probiotics. I take them every day. Then I had to really change my diet. This step is really necessary. Like, there will be no improvement unless you change your diet, because if there are foods that are causing the antibodies to be released and attack the proteins that are in those foods, unless you stop eating them, there's not going to be a difference. You'll keep having inflammation. You could have inflammation of the brain, and if you're noticing these mental issues, like, it's likely because it is affecting your brain. And if you don't fight this inflammation by going on a diet and trying this anti-inflammatory medication and supplements, it's just gonna keep deteriorating your condition. So please, it's very important that you consider do these tests to check the level of antibodies. I checked those 2 that I mentioned, but there are other ones. I read there are 16 types of antibodies. I'm gonna read more about that and maybe make another video. But check those first. Then, just if you're noticing this combination of symptoms, like, you can read more about it online. Many people experience similar symptoms, and they all get diagnosed with autoimmune disease. If you're experiencing this, it's very important to consider that this is what you have: either thyroid disease, Hashimoto's, or maybe another type of autoimmune disease. But you have to focus on anti-inflammatory medication, diet, and supplements. So I started the autoimmune protocol diet. There's a lot about that written online. I started with no gluten and no dairy. That's the start. It's very important. Again, there's research. It's not random. It's not just a fad, but that many people are actually gluten sensitive. They don't have celiac disease. So when I did a test for celiac, the answer was inconclusive. It was a maybe. But anyway, it doesn't matter, because there are many people, they don't have celiac disease, but they're gluten sensitive. And for autoimmune disease, like, there's research that shows that those molecules, like proteins and gluten, cause the release of antibodies, and also proteins in dairy. So it's very important to stop eating that completely. Again, you can always just at least try it for at least a month, completely no gluten or dairy, and see if it starts to help you. Then I had to go further. I read more about it. Also, there are many proteins in grains and legumes, in beans. They're saying, like, they're proteins that are similar to gluten, and there are other compounds which cause your body to attack itself. There is a list, like, written online about autoimmune protocol diet. So no gluten, no dairy, no grain, no legume, no beans, no starchy vegetables. So no potato, for example. So no grains, no legumes, no beans means, like, no rice, no quinoa, no buckwheat, no amaranth, no just peas, no lentils, no green peas. Yeah, it's a lot of things, but unfortunately it just might be necessary, and there's just no other solution. And this is something you might have to do. But at least first try the no gluten, no dairy. See if that helps you, because many people see improvement with already just eliminating those 2 things. Yeah, and then you could try further. So no starchy vegetables, no sesame, and no eggs. Also no coffee. You can read more about this. For example, there's Dr. Datis Kazaryan. He really has a great website. It helped a lot. He just, like, outlines the autoimmune gut repair diet and lists all the foods you can't eat and the ones you can. yeah, so again, if you're trying no gluten, no dairy, don't go out and like buying tons of gluten-free bread, muffins, and all this quinoa, because all those gluten-free bread contains rice flour, tapioca starch, or corn flour, quinoa. Again, this is my case, and it's also a case for many other people that grains can also affect you same way as gluten. That's why, like, that's not a good idea to stop eating gluten but increase your consumption of grains. You can read again more about this on Dr. K's website, and I might make another video talk about it. So what is it like you can eat? But it will help. If you have autoimmune disease, diet is really necessary, and this is what will help. So results, I mean, yes, the results, it helps. You have to do it every day. Like, you have to be 100% gluten-free, dairy-free, and for me, it's all those other products. You can't consume them at all, but it makes a difference. Like, I was able to return to work when before that I couldn't function. I was able to complete the course this fall semester. You know, I'm back to being able listening to podcasts, being interested in something, being able to read a book, not waking up with like intense anxiety. I lost 13 kilograms, which means like that this is probably my normal weight, because now I'm eating, I think, just enough calories, and I do exercise occasionally. So it means all that weight before that for me was all the weight due to the disease. It wasn't healthy for me. Like, this is my normal level, and I'm back at it. Again, the energy is very drastic improvement. Like, I can sleep again from 12 to 8 and go to work and come back from work and be able to read something. When before that, even before the antipsychotics, like, I wasn't able to read in the evening. I wanted to fall asleep like after 6 p.m. and now I'm fine until 12. You know, I can make a YouTube video, I can watch a movie. I'm trying to learn Spanish. Basically, I'm not completely, but kind of back at where I was before 2012, when I was like in undergrad. I was taking courses, I was playing violin, I wanted to learn Mandarin, I was painting, you know, and when this whole symptom started in 2012, my energy decreased so much. I was doing like less than half of the things. Yeah, I don't do as much maybe as I used to before, but anyway, yes, it's better to be rage healthy pretty, probably. Like, yeah, I still have the disease. I don't think it's just gonna disappear. I think I have a quite severe case, because I'm really reacting to like all the food. Some people improve just with no gluten, no dairy. For me, I had to completely eliminate all those things listed in the autoimmune protocol diet. But yeah, it made a difference, and I definitely have less anxiety and depression. Yeah, at least I had energy to make finally this video and to answer this question that's been bothering me for so long about like what the hell is wrong with me. At least now I know. And yeah, there are other things I'm trying as well. I'll talk about them more in another video. There's CBD oil and micronutrients. It came from a TED talk that I listened to. So I started that recently. I'll see how that goes. Also, people mentioned that like honey has anti-inflammatory properties and coconut oil. I'm gonna try that too. But again, I'm not saying like, oh, it's because it's all these natural treatments. No, I'm just saying there are things that work for autoimmune disease, like a specific diet and Cytomel. Cytomel helps me a lot. Again, there's research that there are anti-inflammatory drugs which people use for arthritis. They might actually help for other type of autoimmune disease in general, and they help psychotic patients. So that's something I want to research more, and I'm looking for a doctor who's not going to dismiss my case and will take this idea seriously. Yeah, the CBD oil, that's something that's derived from cannabis. Again, there are papers saying that it helps with psychosis, and it's also anti-inflammatory. I started that. Yeah, so for now, I listed things I'm doing now, like Cytomel, omega-3 oils, the diet, selenium, probiotics, and I'll talk later more about the new things I'm trying. but hopefully if you're experiencing these symptoms, please go check your antibody levels and just consider that you could have autoimmune disease and that it does require diet changes, maybe thyroid hormones and supplements, but a combination of that can help. But it's really important that you start doing it. Like, I wish I started doing this much earlier. I feel like maybe now I have some like brain damage and stuff. I don't remember things that well, but you know, because I had the inflammation for so long. Maybe if you start earlier, you won't have that much damage. Your case won't be so severe. So here are some resources that really helped me. There's Dr. Dacis Kazaryan. He has a website. Check it out. Like, he has some books that you can buy, but there's free stuff. Like, just he talks about the autoimmune protocol diet. He lists the things you shouldn't eat. Yeah, it's free there. Just read about it. He's doing some very useful research, and at least he's taking it seriously that this could be affecting many people and causing depression and not a chemical imbalance in the brain. And also BBC has a very good audio talk, The Inflamed Mind. You could listen to that as well. Also just another research that confirms that it could be the inflammation causing psychosis and how it's the inflammation that has to be treated for patients that don't respond to antipsychotics and antidepressants. So hopefully this video gave you some ideas about what you could check or do, stuff you could read, and I'll probably make some more videos about the other stuff I mentioned that I'm trying. Thanks